Hi, we'd like to spend just a few minutes with you discussing the Primary Care Adult Gero Nurse Practitioner program here at Emory University. And I'd like to kick that off by introducing you to our faculty, or at least our major faculty members. My name is Philip Davis. I am the Assistant Director of the Adult Gero Primary Care program. I'm also a clinical professor, assistant clinical professor here at Emory. In addition to my teaching duties, I also work as an associate provider in the emergency medicine or the emergency department at Emory University Hospital, where I've been for the past 10 years. I see patients at all acuity levels there. My areas of research focus on the care of the older adult in the emergency setting, as well as the health disparities found within the LGBTQ community. I have a list of degrees there that I received from, most importantly, from Emory University, where I got my BSN and MSN. But I'm a second career, so that means that I actually did something else. And for the first 25 years, I was in telecommunications software, and I owned a telecommunications software company with clients around the world. Did a lot of work in business development, obviously, and then sold that company and decided to do something more meaningful with my life. And that's when I decided I really wanted to come to Emory and start this healthcare adventure. Melanie Howard is one of our other clinical instructors. She has a very active and busy practice in women's health and primary care, where she's been for the past 8 years. She has her DNP from Emory, so she's an Emory alumnus as well. You can see she's had quite a exceptional career. Her area of research tends to be in wellness and prevention, healthy lifestyles, and towards that, she got a certificate in obesity counseling. She's also worked in urgent care, and she was a nurse for 20 years before she joined the Emory, or before she started the road to nurse practitioner. Michael Smart, as you can tell by his picture, he's the cool one of the group. He's a clinical instructor. He is a primary care nurse practitioner at the VA, where he does episodic visits, but his real focus is more in chronic disease management. His area of research is kind of focused on having peer support for chronic disease. And so the idea is that he gets a diabetic to support another diabetic so that they work together to have a healthier lifestyle and a better outcome. He just recently completed his PhD at Georgia State and joined our faculty. Prior to working towards his nurse practitioner, he was an intensive care nurse in several of the ICUs in the metro Atlanta area. So what is it we do? And as you can tell, I've grabbed all of these pictures from the Emory website. So these are actual students. Somebody may even recognize themselves if you got your MN or BSN at Emory here. But as an adult nurse practitioner, we are the real answer to the comprehensive health care of our patients. So we build very long-term relationships with our patients. We focus on managing complex health conditions. So that starts with things like trying to prevent diseases, helping people age healthily, but really we are what would be the equivalent of internal medicine if you were in the medical world versus the nursing side. And I wish we had really used that instead of adult gero. I wish we had really used that term to describe our specialty, because it really is what we do. We are primary care providers, as many internal medicine MDs are, but we also are the basis for so many specialties. If a doctor wants to be a neurologist, the first thing he or she does is a year of internal medicine. So they do that in their internship, and then they move into their neurology residency. If they want to be a cardiologist, they start out with a 3-year internal medicine residency, and after completing that, then they go to a fellowship in cardiology. Just the same with gastroenterology. infectious disease, so many of the specialties are that way. They all have a basis in internal medicine. And that's what we do as well. We are not only primary care providers, but we are the foundation for all of the, or most of the major specialties in healthcare. Here at Emory, we not only work to train you to be a provider, but we work very hard to help you learn to be educators for your patients, for your community, to be advocates for your patients, to be advocates for the healthcare system, which leads you to be great healthcare leaders, both in your community and throughout the world. So who do we take care of? Our patients are anybody that is 13 years of age or above. We see everything from the worried well, so someone who's not that sick, to people who are incredibly sick. Our patients, some have great access to healthcare, are very well insured, but we also cover underserved populations, immigrant, indigent populations. We really cover the gambit of the human experience, and we have those experiences as part of our program here at Emory. What we do is chronic disease management. So we focus in a primary care setting, but also in all of the specialty settings where we're working on helping people live healthy lives. We also do episodic type visits, things like annual physicals, sports physicals, people who have colds, flus, lacerations that need sewing up, those kinds of things. We have a very unique kind of procedures, because not only do we do what I just mentioned, things like laceration repair, but we also have several rotations where we work with surgery. So for example, some of our graduates work, and some of our current students are in rotations where they do all of the pre-op planning for a patient. They then go into the OR as the first assist with the surgeon, so they participate in the surgery, and then they do all of the post-op care. This has become a very popular model in surgery because surgeons get paid to operate. They don't really make money doing all of the pre and post-op. And in order to optimize patient care, they need someone who can follow the patient through the entire continuum of care. And that's what many of our graduates, not many, but several of our graduates have done. So they do all the post-op, pre-op, they're actually in the OR with the surgeon, participating in surgery, and then do all of the post-op care. Because we're gerontologists as well, we see some of our graduates move into palliative care, hospice care, end-of-life care, and we have some rotations in all of those that our students have enjoyed. Where do we work? So we work in the outpatient arena, and contrary to some rumors out there, we actually do round on patients in the hospital. So if you are in cardiology and you work in a cardiology outpatient clinic, and that's your basis, and one of your patients is admitted to the hospital, you, as well as your attending physician, may round, or just you alone may do hospital rounds. We have some of our students who rotate with the physician, so a physician may round during the week and they round on the weekend, or vice versa. So you actually round in the hospital. We work in big urban settings like Atlanta, New York, suburban settings, and we also work in rural settings. And we've had some students who really have enjoyed working in the rural environment. That can be rewarding, not only in terms of your patients, but there are some loan payback programs through the federal government that, if you're working in rural settings, can make it very helpful to get your student loans repaid. Many of our graduates work at Emory and other major academic institutions. Duke University has hired quite a few of our graduates, work in major healthcare systems, Piedmont, Wellstar here in Atlanta. Northside Hospital has hired a lot of our graduates. The Mayo Clinic just hired 2 of our graduates, so they're scattered throughout these major healthcare systems. Some really like a small environment, so it may be the owner of the practice and you may own the practice. We had one student in Oregon who started their own practice. And they move on up to some like the larger private practices where there are 30, 40, 50 providers. But as you can see, work in pretty much every kind of healthcare setting, taking care of people throughout their continuum of life. So what about our program? We really strive to prepare you for the real world, and that's our focus. We're not just going to teach you a test so that you can pass boards. 100% of our students pass boards. Within the first 6 months of last year, not only had 100% of our students pass boards, but they were all 100% employed of those who graduated last year. But we focus on really getting you ready to see patients, and that we do through a very unique in some cases. For example, we have very advanced simulations where we hire professional actors. Those actors spend the day before the simulation with a casting director who teaches them how to behave, how to respond to your questions, how to look. And then you go into a real exam room that looks just like one you would see in the real world, with all of the equipment hanging on the walls and an exam table. And there's an actor that you've never met before who actually, you're supposed to be seeing a 50-year-old, he or she looks like a 50-year-old. So you get that kind of real world experience. And what's exciting about that is at the end of that, they give you feedback from a patient standpoint. So they tell you things like, I really felt like you empathized with me, or you came across as you cared, stuff you don't get in the real world. But this really helps prepare you for that. We have opportunities in subspecialties, such as someone who is interested in neurology and particularly movement disorders or Parkinson's. We can provide those kinds of opportunities. But because we work with long-term relationships with our patients, we take a very holistic view. So we look at the patient as a whole person, not just a diabetic. We're not just treating the diabetes, but we try and treat the person, not just the disease. Our specialty has a lot of interdisciplinary exposure. So many of our students will end up in grand rounds with medical students. They end up rotating or rounding in the hospital with the MD, with residents, interns, nursing staff, all in teams to take care of patients. We also participate in all of the immersion experiences that Emory has to offer. We have one at Moultrie where we work with migrant farm workers. There's one in West Virginia. We have some international opportunities in the Caribbean and in Peru and other South American locations where you'll get to experience a very unique patient populations and clinical settings. I think the biggest advantage to our program is that you're not lost in a crowd. So you're not one of 100. We cap our program at around 30 people. With 3 faculty, that means there's at most a 1 to 10 student ratio. So rather than being one of 100, you're an individual to us, and we can provide a very individualized experience for you throughout your education here at Emory. We have rotations, obviously, in primary care because we're board certified in primary care, so everyone will do that. But because we're a smaller group, we can focus on what your interests are and where your interests most lie, and help you find rotations in those areas. At the beginning of each fall class, when the classes begin or the cohort begins, I actually send out a questionnaire asking you, where are your interests? What specialties would you like to experience? So that you can kind of really get some individualized education and also find out if that's really something that you would be interested in. One of the most important things that happens, and I think this is true throughout most of Emory, is that all of our faculty have active practices. So as you saw from the beginning of the presentation, I work in the emergency room. I was there yesterday. I saw a patient at all acuity levels. I admitted 2 people to the ICU. And I also sewed up somebody's finger. So it really spans the gambit. But it's a very active practice. I'm there 2 days a week. Melanie Howard is in her practice as a full-time primary care women's health care provider. So you can see that what we bring to the classroom is real-world experiences. When I lecture, I use examples, and every one of the examples I use are real live patients that I personally took care of. So you're hearing the real world, you're getting the experience of the real world throughout our program. This is probably the most important slide in our short presentation today, because it's what you get to do. If you graduate this program, decide to go through this program with us, as I hope you do, this shows you where you have a possibility of ending up. And it's not a complete list, but this in the past 3 years, so I didn't go all the way back. This is just the specialties that our most current graduates have landed jobs. Obviously, we've got people in primary care, but we've had people in HIV and gender affirming care. We've had people that absolutely love geriatrics and have gone into geriatric practices. I ran into 2 of our students last week who were working in an integrated memory clinic, which is primary care for dementia patients, a unique clinic here at Emory. The concept was invented here at Emory. We've had students go into orthopedics that do that surgical model we were talking about earlier, where they do pre-op, they're in the OR as first assist, and then they do all the post-op care. Sports medicine is another very popular one. Neurology, otolaryngology, you may be more familiar with that as ENT, uses our graduates. Gastroenterology, I won't continue the list. And we'll point out plastic surgery. We had a student graduate last year who's doing a great deal of cosmetic procedures. She absolutely loves her job. We also had one go into dermatology that graduated last December. Every year we have somebody in cardiology. We have several actually in cardiology. That's very popular. We've also had students go into either, some places call them residencies or fellowships. These are not required. When you graduate from the program, you pass your boards, you're good to start seeing patients. But some of our students have found it helpful, particularly when they're in want to do a specialty, to do some further education. And so these are places where you actually get paid to work and see patients, but you're being supervised while you're seeing the patient, and you're getting additional didactic. So it makes you a much stronger nurse practitioner in that specialty. And we had in the past 2 years, students go into neurology, orthopedics. Primary care is one that we started at the VA here in Atlanta, the VA Medical Center here in Atlanta. That's co-run by Emory. It was originally just adult geros. They opened it up to family because they needed more people than we could provide. So, that's a very strong opportunity for our students. Oncology is another one that we had a recent graduate go into. These are places where you just get additional training while you're getting paid. They generally last a year, and then you move on to full practice. So with that, I think I've heard a couple of people join in. Can I answer any questions? All right. Well, my contact details are on the website. I'm more than happy to talk to you individually, more than happy to answer any questions you have. later as you think about your journey and your process of deciding where you want to end up here at Emory. So I'm more than happy to talk to you on an individual basis, help you think through some of this. So please don't hesitate to contact me.